Welcome to the Voices in Healthcare Equity, the podcast dedicated to making a difference in healthcare worldwide. I'm your host, Kim Trenquata, a dedicated physician advocate with over 25 years of experience in healthcare. As an emergency physician and the founder and CEO of Healthcare Alliance for an Equitable World, I've experienced firsthand the urgent need to confront healthcare disparities. Our world grapples with a daunting shortage of 6 million physicians and several million other essential healthcare workers, such as nurses, midwives, dentists, pharmacists, and others. At Healthcare Alliance for an Equitable World, we're utilizing telehealth solutions to bridge this global healthcare workforce gap today. We're not just creating change, we're building a global community of healthcare professionals who can contribute to global health efforts regularly, all from the comfort of their own homes. And with this change, all people across the globe can get world-class healthcare. Voices in Healthcare Equity is our platform to unite this community. This podcast features insightful conversations with innovators in global health, shedding light on the current state of healthcare worldwide and its future. We invite you to join us, be a part of this growing community, and embark on a mission to leave a lasting, scalable impact on global equity within our lifetime. Together, we can make a world of difference. Today's episode features my friend, Milton Chen, who is the CEO and co-founder of VSEE. He's a graduate of Stanford University, where he completed his PhD. He's a computer scientist, but also a philanthropist and healthcare equity advocate. We're so glad to welcome you to our podcast, Milton. Thank you for being here.
And Phil, I'm so honored and privileged to be here. Thank you so much for the opportunity.
Before we begin, I always like to give you an opportunity to identify any conflicts of interest, or if you have any affiliate disclaimers you'd like to put forth.
I think I'm good to go.
Awesome. So if you wouldn't mind starting out by telling us about your company, VSEE, and how you've incorporated global equity into your business.
Yeah, Ken, thank you so much for that. To be completely transparent, when I started this startup journey, I was just completely clueless. I had no sense of healthcare equity, even the needs of the global population. And I was just a big computer nerd. I love computers. I love reading books. I was just like as clueless as you could possibly be. And then when I co-founded the company, then we were just getting NGOs, and they just were reaching out to us to want to use our software in refugee camps and everything. And then we just got started pulling into some of those activities. And then I started just going to, I remember my first trip to Africa. That was to the country of Gabon. And then we went into, it was kind of like 5-6 hours into the jungle, and just seeing the, like literally just no medical infrastructure in there. I think that was planting a lot of the seeds into how we should be both able to build a company that's for profit, like take care of the employees, the great right software. Also our responsibility to actually have, have at least a minor impact to as much as we can, healthcare equity.
That's amazing. Thanks for sharing that journey. What lessons would you say you've learned from working in these resource poor environments and developing telehealth for use in places that are very remote across the globe?
Yeah, I would say there's definitely a lot of little things I learned. It's one of those things that until you go there in person, go there into the field, there's just like little things like, transportation, electricity, of course, the internet, like all these are there. And then I'm pretty privileged, I guess now, fast forward now, I have been to over 50 countries doing in-field deployment. For example, I went to Iraq 3 times. I was in Syria. I would say, as I look back, think about all these places I've been to, all these projects we have done, I think the biggest lesson I learned is, so most people, when they think about telehealth, they think about, let me do a video conference. call, right? Like Zoom, Microsoft. These are wonderful products, have definitely changed the world. But when you come down to doing telehealth, especially in low resource, low income scenarios, video conference is probably 1% of the challenge. The other 99% is, right, what is the logistics, how to get medications. Is the user interface easy enough to use for a community health worker who most likely is a high school graduate? Like, do they feel comfortable using your tools? Right? Like so it's almost maybe the best thing to think about is when you think about telehealth, you think that the value it can create. But most people don't think about the total life cycle cost. What is the cost to actually deploy? Of course, most of these software are donated for free, but if you were to add in how much the training time you need to provide, how much time you need to work with government officials for their blessing, how about even the patient? Do the patient feel like they feel comfortable with these, right? So when you add in all that cost, right, that cost is actually enormous in there. So the key insight we have is today, the state-of-the-art telehealth as a practice in most of the countries around the world, actually the actual cost is much higher than the value they actually create. Because of that, most of these telehealth, they get stuck in pilots, right? For example, very rarely you can go see someone and say they just do full-scale deployment across the whole country. Whereas most of them, they do a little bit pilot here and there. So after a couple of years, they lose the steam and they just sort of stop. Again, I would say probably that's the biggest thing. Really just understand the little details until you can bring the true life cycle cost of whatever program you do until it's low enough, you actually have a positive return on the investment.
So how are you and your VC team working towards managing that cost and making it equivalent to the benefit?
Yeah, thanks for that question. I think the number one thing is I would definitely think is our team is definitely not any smarter than the other teams in there. But what you need to do is you just need to go there, right? Like you can't just say sitting in the Silicon Valley here or in America, say, let me build something there. You just gotta get on the airplane and go there. In fact, you can't just go there once. You have to go there enough time to a little bit immerse yourself into that scenario. And then what happens is, at least what we find is once you immerse yourself into the community you're serving, as you watch the people use your product and services, then literally I can almost guarantee you, every time you do this, you're going to come up with like 50 things. Oh, we could do better here. We could do better here. Like, then of course, then you go talk to the engineer, fix that. Then the next time you go there, another 50 things you do it. Again, I think that's how it's our formula in there. Just go there and make changes. Every time it gets better and better and better.
That's a very common innovation cycle, right? You test, you get data, and then you improve and you keep going forward and forward.
Yeah, I would say in that case, how maybe VCs are a little bit different from other telehealth companies. So we spent over 500 man years create a set of Lego-like building blocks. So the idea is, right, for example, if you think about, let's say you want to build a house, you could just go build your house, custom design, everything there. Or you could say, let me manufacture in a way, can I just get a bunch of plug and play components, like a piece them together, then using that method to make my house. So essentially VC doing that by having this for a bunch of the Lego-like tech digital building block. So now allow us to make these changes very fast. So often, for example, when we do deployment, when we actually do adjustment of the software in the field, like literally we'll be, for example, running a clinic. I remember the first couple of trips were in Iraq. Literally, we do a whole day work in the refugee camp. At nighttime, we're writing code, changing code, making adjustment. Next morning, we have a new version. Again, I think by making it very fast to make changes in this, then of course you can speed up the innovation cycle. Then you can be able to get to that really easy to use software experience much faster.
Takes a lot of dedication to work day and night to innovate on the run and on the fly, I'm sure. How do you stay up?
I know like when me and my team go there, just seeing actual patient, serving actual patient is the biggest adrenaline rush you get, right? That we get so much like ideas that we just can't wait to go back to a hotel and start like making changes to workflows. I would say it's actually pretty easy because it's just sometimes just like the problem you see, like the deficit, the improving user interface, the workflow, like it's so obvious. It's like we can't let people experience that thing tomorrow. Let's make the changes the next after dinner and so on.
Well, it sounds like you're really driven by the ability and seeing the good that you can do for people.
Yeah, I think I really feel like we're in that one moment, maybe like history and time where the healthcare system, not just in the US, but globally, is getting digitized. Yes. Like, for example, if you go to the Philippines, they have massive program, universal healthcare coverage. There's like, they have just a lot of these infrastructure, just like every country, right? They're doing these. I think the impact on people's lives is pretty profound in this. That's why I almost feel myself I'm very lucky to be able to at a moment in time we get to do something that hopefully have a big positive. And also by the time I think the organization you built in it is like amazing. Like this is like to be a catalyst for good and it is so awesome. So.
Well, thank you. I think we have connected and worked together because of that drive to make the world better. As you go into these low resource and rural communities, what would you say the greatest telehealth and healthcare equity challenges are that you see?
Is your software or services, is it designed for low resource rural communities in there? So what I mean by this, right? For example, there's a lot of user interface. If you were to deploy to, let's say, Kaiser Permanente or a US big hospital, it's no big deal, right? But that same user interface you deploy in the low resource setting would not work. I'll give you an example. So we have a massive project called the Baby's First 1,000 Days Project in the Philippines. We're on track to manage over 100,000 moms and babies. And now in the case, right, so we have to work with the local community health workers. We're actually knocking on doors, tracking babies, like their nutrition, there's all these things, right? So we develop a set of digital forms for them, but paper is just much more easy to use than anything digital. Let me work with you. Let me try to understand what are the challenges to technology adoption. Then by working with them over the past couple of years, now we actually made a number of very small, subtle user interface adjustments. And now they actually feel, oh yeah, I could do this. This is actually better than paper. That's right. Of course, that's just one example where you really have to understand in those scenarios, right? You can't just say technology is always better. In fact, paper is amazing technology. In fact, in many cases, paper is much better than whatever fancy tablet you had in it, right? It's a lot more robust for one thing. And if there's no internet, if you lose electricity, paper still work, right? Just like you have to understand those things to really have something successful. Another big thing we do is that, when in the US, people talk about you gotta make it something easy to use and stuff, right? To be honest, if you just between the two of us, right, I think a lot of them are lip service, right? At the end of the day, right, if you go to a hospital, do they really pick the easy to use whatever software? Not really, right? In the IT, just pick whatever things, stuff it down the like clinician through. You can take that same approach going to that. It just what happened is you see is people want to be respectful. They'll say, oh yes, they'll use whatever thing. You fast forward 2 years later, are they doing that? No, it's too complicated. So you really have to make it really, really easy to use. For example, our target for how much, for example, we have a simple EMR. We actually use it when we run these free clinic in other countries. So our target is, could you take a physician who have no experience with VSEE, Could they spend 30 minutes, do a quick training, normally in the morning before we run this for free clinic? Could they become expert user with 30 minutes of like a group training? If your software cannot achieve that, there's just no way they could deploy. So we work enormous. Yeah, we could actually achieve that. Like literally, I could take a physician, have no idea what VC is. Sit down 30 minutes. They could do document, they could do scalpel, they could do telemedicine, they could do remote exam. So they become those. So I think that's another thing that was become really, really. And then the final piece is, so healthcare is such a big problem in this. You must work with the government, right? So typically these healthcare projects are initiated by the NGOs. For example, Cambio NGO is awesome in there, right? Like just like, so, but NGO can only do so much, right? Because again, at the end of the day, right, healthcare is very expensive. It's whatever country, every city, it's going to be a big part of GDP. It's healthcare. A big part of government expenses is healthcare. So you must work with governments. I mean, you have to spend time, right? Go meet the mayor, go meet the governor, go meet their chief of staff, go meet the, their chief medical officers. In fact, if you don't do this, so often when you get a cases, right? Again, I almost wish this could be maybe off the record. That's right. So I don't want to position the way not like that. So also what happens is we have a lot of good like good-hearted Americans, right? They want to volunteer. They go to some countries, they go there for a week, then they leave, right? When they go in there, they cause a lot of disruption to the local healthcare system. When they leave, now what? It's almost, you could, even though the people mean really, really well, the actual impact, or even potential negative impact, could be even worse, right? Like, do you go there? Do you make the local physician look bad? Are you sort of taking away their livelihood? Now all of a sudden the local community patient to come to your free clinic versus going to the normal doctor. It's just like all those issues, right? It's like, I mean, we exist within the fabric of the community. If you don't go there, my first question is, what is your 10-year plan? In 10 years from now, are you still there? If you just go there, show up 1 week a year, sometimes, to be honest, if you don't show up, it might actually be better, right? I just want to say like legitimately, right? Sometimes it's like it shouldn't be almost like going there. You have to really understand, okay, like really understand, go in the community, right? But when we do a project, the first thing we say, we don't want to come as here's a Silicon Valley company with some technology which I know better than you. Just do what I tell you. So in fact, when we go in the community, the first question we say like, how about you tell us the challenger? Let me just listen to you. Like, I'm not going to tell you about my technology in there because I don't want to buy it. So just tell me your challenge. Is TB? Is maternity? Is senior care? Is or maybe just nutrition, or maybe environmental factor. For example, we work in, we've been running a clinic into like right next to a massive garbage dump in the Metro Manila area, right? In that case, sometimes it's just the environment. Right? So we want to understand is like, what are the issues? What are the challenges in there? Only until you have listened enough, really truly understand that, then I think you can say, okay, great. Okay, maybe it's some sort of value you could take, whether it's technology, medical expertise, or other thing. Then you want to, again, whatever solution you do, it must become a fabric of that society. If you don't do that, it's almost like it's almost like going to someone's house, pour out a bunch of things, then you leave after a week, and then they have to go clean that again. So that I would strongly recommend, like, don't do that.
So sustainment of international and global intervention is a very important thing for the governments and for the local communities. And it's an important part of ongoing trust building with those communities as well.
Well, definitely. I think that the key word, I think, is that trust. Right? First, it's just like, I think, unfortunately, the whole world, because there's so much money behind the whole NGOs, all these things, like I said, it's really, these are people who really means well in there, right? But if you don't become a fabric of the society, if they don't trust you, if you don't have a 10-year plan that's still serving them in 10 years from now, then it just often is the amount of good you could do is actually very, very limited.
And if you're not going to be there in 10 years, what is your plan for making sure that they can take over the same?
Yes, exactly. It could be, for example, I'll give an example. Right now, a lot of communities, solar is a big a savior, and because they don't have stable electricity in there, you could create, let's say, some inventions around whether it's a controller of the solar, how better way to manage the power of this. So this could be, if you create that, train the local community, they could troubleshoot, do this thing. That would be your 10-year or 50-year plan, right? They would definitely benefit from this.
Thank you for joining us for this two-part episode with CEO and co-founder of VSEE, Dr. Milton Chen. Join us again next week, where we'll continue our conversation about telehealth in the Philippines. If you enjoyed our episode today, please share it with a friend who you think would also enjoy this topic and conversation. Please also leave us a review, as we'd really like to hear your ideas and feedback. If you'd like to be a guest on our podcast, email us at info@haew.org. If you'd like to learn more, join us, partner, or donate, please go to https://haew.org.